First of all, thank you so much for taking the time to be with us this morning. I really appreciate it. And I think we're all...
I want to say thank you to you and your audience, people that care enough about this issue. Go ahead.
Well, that's an important one. And there has been in the past, I think this is one of the maybe relatively few areas where we've seen previously some level of bipartisan working together in Congress. And I want to just start off, do you think that will continue?
That's a good question. In the past, this is my 9th year in Congress. And we had first, the fight on this issue was to get people aware of the breadth and depth of the problem. So we spent years first getting the committee on board, understanding what the problem was and how it penetrated. And once it got going, we were fine. Last year, in the last session, the 115th Congress.
It's a crisis. You gotta pay attention.
In the last Congress, the 115th Congress, we had 7 hearings. We developed a report, a 300-page report, bipartisan report to come together. We put together some lists of activities that we think could have an impact with it, but it took a while to get everyone up to speed. So, Sam, to your question, the frustration I have is now 7 months into the 116th Congress, under Pelosi, we've had 1 hearing versus 7 in the previous 2 years. I'm hoping that they will join on, because once we get going, once we get understanding, I think people will join in and they'll fight together on this to get it right. But it must not be the problem in California and in New Jersey like it is in West Virginia, Kentucky, Ohio, New Hampshire, and elsewhere around the country. They're not seeing the same sense of urgency that we are.
And what do you think it takes? I mean, if Speaker Pelosi said, all right, write a bill and I promise I'll put it on the floor.
That's the bottom line for anyone that doesn't understand the process. Yeah, that's exactly what. They all get their cue from the speaker, and the same thing with over in the Senate. The majority leader of the Senate will tell you what's going to happen over there. So if they really want to do it, they can do it. I'm not saying that Nancy Pelosi or Frank Pallone or any of them are against this issue or not willing to fight for it. It's just they have their priorities and they're going to work them down through, and we'll get to them. We've had our first hearing, and it was a pretty dynamic. It was a good hearing on it to understand it. But what I want to do is, from my perspective, is get back to the basics. One, finish the job that we got stopped in. We lost the election in 2018, and so Nancy and Pallone took over the leadership. But the one that we had failed in trying to get was we wanted to have the pharmaceuticals come in. We had the distributors, we had the FDA, the DEA, we had so all the other players, the docs, pharmacy, all of them came in and testified in hearings. But not the pharmaceuticals. Big Pharma stonewalled us. I think they need to be held accountable because they're the ones that are shipping the drugs through the distributors. And the distributors, I remember my questioning when the distributor said, we don't think we had any responsibilities for the penetration of drugs into Appalachia or elsewhere across this country. I thought that was absurd, that they would make that claim. So we have to, there was a nice article in the Washington Post, not necessarily my favorite newspaper, but nevertheless, if you've seen yesterday or the day before's newspaper, it talks about the penetration of where the drugs went. And there are communities that you could see on this, the communities that have 200 and 300 counties, 200 and 300 pills per person, per county. What were they thinking about? Why was Big Pharma continuing to do this and allow their distributors to do this? So that's why right now, Sam, I'm working on legislation with a friend of mine. On the other side, everything we do is bipartisan to try to get to where we have suspicious orders. They knew, or should have known, that amount of order going into Kermit, West Virginia, or War, West Virginia, or Ashland, Kentucky, by the way, they should have recognized that's an excessive amount of pills going into there. They did nothing. So our legislation will start to address that.
And so can you elaborate on that a little bit? When you say pharma needs to be held accountable, what does accountability look like?
Well, it's pretty broad, but primarily I think, I don't want to get to all the penalties, whether it's civil or otherwise, but they've got to stop it. They've got, someplace along the line, someone has to be held accountable. There has to be, I hate that word, it's way overused, transparency. No, let's just hold people accountable for what they're doing. They knew that they were selling drugs into, when you have 203 pills per person living in Mingo, West Virginia, come on. You're putting something ahead of public health when you're doing something like that. So I want to hold them accountable. It may be time. It may actually go to the penalties to do it. Someone's got to stop. They knew, they had to have known that was an excessive amount of pills going into that. Because again, from this you can see some counties around the country had nowhere near that kind of penetration.
Yeah.
Why was it in that one? So someone needs to raise the question and then be held accountable. If they've done it, maybe either heads roll or they spend some time thinking about it in a cell. But someplace this has got to stop. I'm tired of seeing it in West Virginia where we have 57 deaths per 100,000. 57 deaths per 100,000. 215 people across this country died yesterday because we haven't completed the resolution to this problem. 215 people will die today. 215 people will die tomorrow. In West Virginia, a person dies in West Virginia every 8 hours. And we had our first hearing in 7 months. I think we need to be more judicious of our time and to see what are the ones that are really affecting people's lives rather than worrying about some things where it's going on in the White House. There are problems there, I understand that. But let's deal with the things that are going to affect this country and affect people's lives.
So as we sort of both try to understand the origin of how all of this came to be, both, for, as you said, to hold people accountable, but also to sort of figure out the appropriate policy solution, because that'll probably be something that's pretty multifaceted. You wrote a letter to HHS Secretary Alex Azar in April, not too long ago, and I just want to read everyone one line from that because I think it's a really important issue that you raised. You said CMS, which would be Medicare and Medicaid, is incentivizing the use of pharmacy-dispensed opioids over use of pharmacy-dispensed non-opioid alternatives.
Yes.
Have you gotten a response?
No. But it is part of the cornerstone of why we need to pursue this. I want to understand why we're using opioids as the first choice. Go back to England. I've got to think their medicine is very similar to ours other than being socialized. Their drug overdose rate is 4 per 100,000. France, it's a half a person per 100,000. What are they doing in the European nations? Canada's half what we are, the overdose death rate in the United States compared to the United States. What are they doing? Are the doctors the ones that are responsible for this? Because in the past, are they the ones that were over-prescribing opioids instead of non-opioids like Motrin, Tylenol? What about acupuncture? All these other things, physical therapy. We could be doing all those other things. I've worked with Parcell out in New Jersey when we introduced legislation. I've probably got close to 10 amendments on this in the last few years to address this problem. What the focus, Sam, if I could, really, I'm looking non-opioid treatment, but more importantly, I want to go back as an engineer. Let's roll back. Why are people using drugs, opioid drugs, in the United States compared to England, France, Wales, Canada, Australia? Why are we doing that? What caused us to have such a dependence? Is it our microwave society that we want fixed right now? We want to get rid of the pain? Is that what it is? Because then we have to, then we can look at the policy. But from an engineering perspective, I have to first understand why you're using drugs in the first place, and then we can work on it. But we're doing a better job now on the rehabilitation.
So I want to pick up on that. I can see our time is ticking down.
Yeah, you got me at
But
12 minutes to talk
smart
about my
brevity
favorite
has come.
subject.
There was a story in the New York Times earlier this week with some officials from states, particularly states that didn't expand Medicaid, which obviously West Virginia did, but
Yes.
saying, look, Congress has provided money. We appreciate it. It's gone pretty far. This is money for treatment, which you were just getting to, but it's going to run out. Will there be, do you think, a sustained commitment to sort of the long-term work?
Oh,
of helping
there
people recover?
better be, or they'll face my wrath and some of the other folks on the thing. This is not a short, we can't just throw money at it and think it's going to go away. We've got to have 10, 15, 20-year plan how we're going to address this problem. And I'm hoping that is, but also that's why we went back to, in West Virginia, is worked on grants. We worked with SAMHSA. SAMHSA dropped the ball the first year, but one of our amendments that we put in specifically addressed where you could get grant money for rehabilitation services for counties that are particularly hard hit. That wasn't in the bill. We got that put in the bill. But then SAMHSA, in its first year of funding cycles, West Virginia got nothing. We had neonatal grant applications that were denied. 21 applications were denied. So since that time, we had SAMHSA come in and we put on a workshop. And we had 125 or 140 people, whatever it was, in all 20 counties. And all of a sudden now we have a 5-fold increase in the amount of grants that we're getting in West Virginia that's going to address some of the hard-hit counties. We've got to make sure that spreads out all across the country. For those counties that know they're hard-hit, they've got to have access to funds. And we'll help them in those grant writings and working with SAMHSA. SAMHSA has now turned 180 degrees. They're working with us to get these funds in the hands of people to do rehabilitation. And that goes, I know we're out of time on a thing.
All right.
Is so looking at things like, what are we going to do about the 28 days? Where did that come up with? We've written a letter on that. What was 28 days for rehabilitation through CMS? Why is SAMHSA tying your rehabilitation funds to having medically assisted treatment? Maybe there's some alternatives that we won't have to do this. So we're still going to continue to fight as we go forward to alternatives to just using opioids or some of the traditional methods. And so I'm looking forward to this debate. We're going to have a lot more, hopefully, if we can get Frank Pallone and Nancy Pallone on board, or Nancy Pelosi.
All right, well, we will see. Thank you so much for
Thank
being
you, and
with
thank
us.
you for your interest.
Sharing your
out there.
expertise.
Thank you. God bless all of you. Okay.